It's no secret that as we age, our body changes in ways we wish it would not. One spot particularly troublesome for some people is the neck area. Now, there is now a cosmetic procedure available called Slim Lipo that could help turn back time. Dr. Beth Collins is a double board certified plastic and reconstructive surgeon and is here to tell us more about it. Welcome back, Dr. Collins.
Thank you. Hi, Jocelyn. How are you?
Oh, doing well. All right, the neck.
Yeah.
Okay, that's a major sore spot for not just women, but men as well as we grow older.
Absolutely. I think the reason why we see a lot of age in our neck is because we forget. We forget to treat it with the creams and the things that kind of proactively prevent the aging, and then before you know it, you have a lot of loose hanging skin. But another thing that I wanted to address today about the Slim Lipo was the people who gain a lot of weight in this area. And actually the thickness in the neck can not only age you, but make you look a little bit more like you have a lot more weight on you. And by taking this away using liposuction techniques and the Slim Lipo laser, we could really help people take away the age and the look of being a little bit heavier than you are.
All right, but what can you do? What can you do to prevent some of this damage?
Well, from the
Obviously
standpoint,
diet.
Well, absolutely. From the standpoint of the thickness of the neck, of course, keep yourself in shape,
Yes.
and that will help. But sometimes it doesn't. There are people who just happen to carry weight in different areas, and there are people who have it in their neck, and it's a spot that is troublesome for them, and that's where liposuction is really perfect for somebody who's not trying to use it as a weight loss mechanism, but to more contour.
So how does Slim Lipo work?
So Slim Lipo is a laser treatment that is augmented with traditional liposuction techniques. So it has two wavelengths in it, one that helps melt fat and the other that stimulates the water in your skin. So when it heats the water up in your skin, it helps the skin contract to smooth it out and take the wrinkles away. So that is used first in the procedure and then followed with liposuction. So you actually take the fat away out of the neck if there is excess fat and then use the laser to firm the skin up afterwards.
How long is this procedure?
It takes, I do it in my office under local anesthesia, so it's quite easy. It takes about 45 minutes to an hour. The recovery is fairly simple. I have people wear a compression garment for about a week afterwards, and then at nighttime for another week. And there could be a little bit of bruising, but it's generally pretty easy to recover from, and it has amazing gains associated with it.
How soon do you see results?
Instantly. So there's a little bit of swelling that persists for a couple of weeks afterwards, and the bruising usually takes about a week to go away. But the results are instant because you are, besides using the laser to melt the fat and firm the skin, you're actually taking the fat out. So once you get rid of it, you see that contour really coming pretty quickly. And then over the next couple of months, things will smooth out and become what they're going to be. But it's pretty quick.
That's amazing. All right,
Yeah.
so what are the risks involved here?
Mostly the thing I see most is bruising. It's not a very risky procedure, honestly. There could be, if done improperly, or you go to somebody who isn't particularly licensed in it, or which I would never, you have to make sure that you're going to somebody who is well trained in the procedure. You could end up with contour abnormalities, something that doesn't look very good. Another thing is that it has to be applied to the right patient population. This is not a procedure for somebody who just has loose skin on their neck. Somebody who has that is going to need a facelift or a neck lift or something to just smooth the skin. It's not going to do that much for just that crepey look, but it's really good for somebody who has a thickness in their neck, and I think I have some pictures.
Yes,
so.
let's take a look at these pictures. I was just going to show everybody what we brought here.
Yeah, so
okay.
These are patients who are really good candidates for it. In the before picture on this lady, you could see she just had a thickness to the neck, and her skin was very good quality. I would consider her a perfect candidate for this.
Again, it's for contouring.
It's for contouring, yeah. And it does, despite the fact that it's a contouring procedure, it does make you look a whole lot younger. In addition, that thickness and we call it, this is a mouthful, but the obtuse cervical mental angle that you see where your neck is kind of going down into your chest is, it's aging. So
Now
this
the
is-
after picture really, oh, sorry, the
Yeah.
previous picture, how many weeks was that after the surgery?
That was 3 weeks after.
3 weeks after?
Yes,
Okay,
yes.
and what about this one? How many weeks after?
So this is 3 to 4 weeks after. So
Oh
about
my
a month
goodness,
after, yeah.
seriously?
She was a little bit more of an involved procedure because she had a little bit extra there.
Almost
And-
like a double chin.
Yeah, yeah, and she really got a good result from that. And here's the other lady. This one, I think you see more of the anti-aging effects in this lady. We don't see her upper face in this, but you could see that her neck was going right into her chest area, and it just makes that angle much better, and it not only improves the way you look, makes you look prettier, first of all, but it also makes you look a whole lot younger.
I'm sure they were very happy with the
oh, they
results.
were.
Now you have a seminar coming up.
I do, yeah. So I'm very much, I believe in the holistic treatment, and like we were talking about earlier, I think the best way to do things is to prevent them. And my results are better when you're at your optimal weight. So a very good friend, and actually my personal trainer, is coming in to do a seminar on weight loss, and I'm going to do a body contouring seminar at the same time.
And this
So
is on Thursday, September 26th at your Guilford office.
It is.
And that is located where?
It's 2614 Boston Post Road in Guilford.
There's the address right there. And to contact Dr. Collins, you can call that number 203-689-5295 or visit BethCollinsMD.com.
That's it.
Okay, I love the results, Dr. Collins.
Thank you.
Thank you so much for joining us.
Well, thank you for having me.
You're welcome. Up next, salmon is on the menu, and I'll head to the kitchen where Chef Leticia will share her Brazilian recipe. But first, take a look at this.